known important topic. Before we begin, I would give our audience a general insight about what this BabyChakra all about. BabyChakra is India's largest pregnancy and parenting platform, and it is one-stop solution and one-stop destination for pregnant women and expecting parents. We try to connect with parents with experts who bring valuable information and research-based information to all. On that note, I would like to kickstart our topic for today. We are going to have an informative discussion today on steps to manage a colic baby, an easy mom guide. And we have an amazing lineup of guests in this live session. Welcome Dr. Sonita Dalal and Dr. Rupal Agrawal. Doctors, can you please introduce yourself, Dr. Sonita Dalal?
Good afternoon, friends. I am Dr. Sonita Dalal. I am a consultant pediatrician and neonatologist. I practice in Ahmedabad at Excellent Hospital opposite Ladli in Narayanpura. My pediatrician handle is pediatrician with a AE_mom. And I've been practicing, doing private practice since 6 years. So including the experience of my residency, I've been in this field since the last 9 years, treating babies, and I'm a mother myself. So I have a 2-year-old son. So that also makes a lot of difference. I also hold a postgraduate diploma degree in pediatric nutrition, which I have done from Boston University. And I've been doing practicing as a lactation consultant as well, but I haven't really done it. It's more of a practical knowledge. So that's it, about it.
Thank you, Doctor. Thank you. Dr. Rupal Agrawal, can you please introduce yourself?
Yes. Hello, everyone. I'm Dr. Rupal Agrawal. I am situated at Nasik, Maharashtra. Basically, I'm endodontist, that is root canal treatment specialist and a certified lactation educator. I have a 12 years of experience with my dentistry and just 4 years of experience with my breastfeeding consultation. I have 2 babies. The elder one is 5 years old and the younger one is just 1.5 year old, and she is the naughtiest one. And my Instagram handle is Dr. Rupal Agrawal Lactation Consultant, and the Facebook handle is Dr. Rupal Agrawal Gadodia. Thank you.
Okay, thank you for that wonderful introduction, Doctor. Let me introduce our audience the topic once again. And before that, I am thanking you for joining this live today and sparing your time for sending and spreading some beautiful information to our audience. Thank you, doctors.
Thank
Yeah,
you.
the topic is babies with colic. Back to track. The topic of discussion today is steps to manage colic in kids. Babies with colic often respond so well when they are always held and they are always being close to us, right? So yes, it is always recommended to take an advice from a pediatrician if the baby cries excessively. And let's discuss what's the best way to indulge in the conversation with our experts in the panel today, and they will address the topic in depth. We shall begin with the questions of our guests today. Dr. Sonita Dalal, what is actually colic and how do babies get it?
Okay, colic is actually, it's a very broad term. Simply stated, it is a baby who's crying excessively, who's fuzzing a lot, who is irritable, and it is for no obvious reason, it is unexplained, and it cannot be prevented or resolved easily. Now there are criteria. Traditionally, it used to be classified using Wessel's criteria, which is a rule of 3. It's a simple rule of 3 that includes that a baby who's been crying for more than 3 hours in a 24-hour period, for more than 3 days a week in this way, and for 3 or more weeks. So that is how it was traditionally defined. But now it's gone out of place, because you wouldn't really wait if a parent in distress comes to you with crying baby. You're not going to wait up for 3 weeks to really label it. So there are modified Rome criteria now, which is simply broadly defined as a baby who is excessively crying or fuzzy or irritable without any obvious cause, and something which cannot be prevented or resolved. I'd say it is a diagnosis of exclusion, because I would like to focus on this point that not every crying child is equal to colic. It's a very common mistake that every time the baby cries, the most common the interpretation of a parent or a caregiver is that the baby is definitely having colic. Now, babies cry for multiple reasons. Again, I like to explain it to my patients that you cannot expect that a child will just grow up without crying, right? It's their language of expression. So there are multiple reasons why a baby cries. Sometimes it could be hunger. Sometimes it could be just they just want to be held. Sometimes they've passed urine or stool and they're just telling you something. So only if it's excess, or generally a baby's cry is consolable. That is, when you give them the solution, the crying stops. Colic is generally defined when the cry is inconsolable and persistent, and you've tried everything and it's not working. And of course, you have to get the baby checked with a pediatrician, so they would rule out any pathological or other obvious causes of crying. If there's no other cause found on examination, then it is a diagnosis of exclusion. That is when we would really label that this is infantile colic. So that is how we would define colic. They're coming to the causes. You asked me that what are the causes
Yeah.
of it.
Yeah.
Again, sadly, this is something which has been researched a lot over the years, but there is no specific cause. It is what we call as idiopathic in our branch. That there's no identified particular cause, and because the cause is not specifically known, we do not have a pinpoint specific one-stop solution or treatment, or it's not a completely preventable thing. But babies generally do grow out of it, like 3 months, 4 months down the line, they generally do grow out of it. There are theories, of course, there are many theories. The most common and important and the obvious explanation is colic. It literally means something related to the gastrointestinal tract, right? So the most common theory is that when the babies are feeding, they are also gulping a lot of air, which we call as aerophagia. So when you burp the child, when you lay the child on your shoulder, pat on the back, what comes out in the burp is some of the gulped air. The rest of it passes down in the intestinal lumen. Now, when a lot of gas collects and there's a big bubble over there, so it might hurt the baby, and that is what causes a visceral pain or colic. So that is the most common and most logical theory, which makes sense. Apart from that, there are also some neurological psychosocial theories, related to maternal parent and infant interaction and responsiveness, and but nothing is proven. So this is the theory which makes most sense. The gastrointestinal theory is the one which is the most logical. So that is why exactly they have colic.
Okay. Thank you, doctor. That was a very clear explanation. Thank you so much. And Dr. Rupal Agarwal, what are the colic symptoms in breastfed babies?
In breastfeed babies. Okay.
Yeah.
So the symptoms of colic in breastfeed babies are, as Dr. Sonita has told, that the baby cries inconsolably. No matter what you do to comfort your baby, no matter what you do to console them, they cry excessively. Their face gets red flush face. Secondly, they will try to pull their legs towards their chest. Okay, they will arch their back and close their fists as in they are in severe spasmodic pain. The entire scene, the entire position of your baby will seem like the baby is in complete distress and is very painful situation. This is the most important symptoms of baby who are in colic in breastfeed babies. And for the rest of the day, if the baby is happily feeding and happy and active, but for a particular period of time, for example in the late evenings after 6 p.m. to midnight, and if the baby is excessively crying for this period of time, for, as the ma'am had said, for 3 hours a day, for 3 weeks, 3 days a week, and for more than 3 months, then we term it as a colic, right? Otherwise, as ma'am had said, crying is the only medium that baby can communicate. That is the only way he can tell you that he is hungry, or he just wants to be held, or he just want to change the diaper, or just want to go on a ride, or anything else. Okay, so these are the symptoms of colic in breastfeed babies.
Thank you, doctor. Thank you. That was a perfect explanation for the mothers, for the breastfed mothers who are almost struggling with this most common
Yes.
problem in all over all their families. Dr. Sonita Dalal, what is colic? Sorry, how to check and how to help a colic baby?
Okay. To put it simply, when I explain to my patients, I tell them that first of all, when a baby cries, you check everything. First, you rule out the simple and normal causes that, has the baby soiled? If not, then try to latch the baby. If the baby gets quiet by feeding, that means it was a hunger cry. Suppose the baby is not even feeding and just going on crying and not getting pacified by breastfeeding, then you can take the baby on the shoulder and pat a little. And there's a typical pattern seen in these babies having colic, that they would be comfortable only as long as their tummy is being pressed, so as long as you're patting the back, or you put them, on their tummies, we give them tummy time and you gently pat on the back, they would be comfortable for that time. And as soon as you put them, lying on their back or in a supine position, they would start crying again. So that is how you catch the problem. And then of course we have to pacify the baby a little with the help of feeding, with the help of moving about and just patting them a little bit. If that doesn't work, then there are some medicines. Again, research shows that the role is not very clear, or not conclusive evidence is not there for either of them. But there are two, three things which can be done. There is a drug called simethicone, which is an anti-luminal, it's an anti-foaming agent. So the luminal gas, which we were talking about, that intraluminal gas collection, so that would resolve with the use of that. So we could give them simethicone drops, 5 drops, as and when required, just to give them some relief. There are some antispasmodic agents like dicyclomine, but they are not really allowed to be used in children under 6 months of age, because there are some potentially bad side effects, such as a lot of drowsiness or sleepiness and apneas and all. So they are not really advised. So your product should be. That is why you have to take the advice of a pediatrician or a proper doctor who will prescribe you the product which is allowed as per the age specific criteria. There are also antispasmodic agents like camellophyllin, which is approved in children under 6 months or since birth also. So if it's too much of a problem, we could give that. There is another study which suggests about the role of probiotics. There is a probiotic called L-Reuteri, Lactobacillus reuteri. But then again, only it has been shown to be effective in exclusive breastfed infants. A 3-week trial of a daily dose of L-Reuteri might help. So then again, there are studies which show that it's not effective. So you have to customize the treatment based on how much is the problem. If there any pathological cause has been found, like this is a diagnosis of exclusion, right? So we have to take a proper history. If there is any evidence of cow milk protein allergy, then we might go for restricting cow milk dairy products from the mother's diet. And if not exclusively breastfed, then we can go for some hydrolyzed formulas, which will alleviate the symptoms. But there will be accompanying symptoms like a lot of diarrhea, vomiting, failure to gain weight. So there would be associated symptoms which would point to a specific pathology. Then we have to treat the pathology. Here, I would again like to stress that a common mistake or myth that happens is that the day the child has colic, it is attributed to whatever the mother ate that day. So today you ate mango, mango must have caused colic. Now stop mango, no mango now till you breastfeed. So that is a very common mistake that they do, and so the poor mother is, whatever she ate, it's just a coincidence. There's nothing which you can really do to prevent that, and there is no direct relation with the mother's meals, unless that it's a case of it's a diagnosed case of common protein allergy. Apart from that, there is no relation to the mother's meals. But whatever the mother ate that day, it stopped. Either she stops herself out of mom guilt, which we all have at some point or the other, or somebody would comment and make them stop. So you do not, as mothers, need to restrict anything from your diet. Especially the day your baby has colic and you stop eating all those things which you had that day. Please do not do that. There is no role of that. And some non-pharmacological measures, soothing the baby, taking them for a car ride. Again, there's no proven role, but some of them they do calm down. So you could try that also.
Thank you, doctor. The This would be a great relief to many mothers over here, because, like you said, many may think that the whatever we ate causes harm to the baby. That this is one of the ice-breaking point, I would tell. Thank you for that, doctor. Dr.
Yeah.
Rupal Agrawal, can you
Yes,
share us some tips to cry a soothing baby? Sorry.
yes,
So,
definitely. Yes. See, first of all, I would like to tell mothers, जब भी बच्चा रोता है, the first thing the mother feels is कि something I have done wrong. I am responsible for my precious one crying. So the moment she feels such, she goes into distress and she start feel guilty, fall into the guilt trap. सो ऐसा नहीं है कि अगर बच्चा रो रहा है, बहुत ज़्यादा रो रहा है, तो यू आर ओनली रिस्पॉन्सिबल. As I told, baby cries for n number of reasons. So first of all, please don't fall into the guilt trap. Try to take hold of the situation and think what best you can do for your little ones. So जो सबसे easily हम वो कर सकते हैं, try to breastfeed first. If it is a hunger, your baby will stop crying, and then I'll say you are a lucky one कि breastfeeding से आपका problem solve हो गया. Now the second point is, if you are breastfeed, your baby had already taken feed and he feels satisfied but still he is crying, then what you can do, you can start burping in the middle of feed and after the feed as well. Try to burp for 3 to 4 times. That will relieve the excess trapped gas which is there in the intestinal lumen, as ma'am had said. Now then you can go for changing the diaper. Completely undress the baby, remove every piece of fabric from the baby's body. पता नहीं बेबी को फैब्रिक से कभी कुछ चुभ रहा हो. Sometimes the name tag, the brand tag which is there at the shirt of the baby or the dress of the baby, वो भी बेबी को कहीं irritate कर रहा हो, तो you can completely undress the baby and see if your baby is consoled. Then the next point is comforting touch. कंफर्टिंग टच मीन्स बच्चों को सबसे ज़्यादा जो सेफ एंड सिक्योरिटी देती है वो है द नॉलेज दैट ही इज इन सेफ एनवायरमेंट, राइट. वो सेफ है, सिक्योर है. वो कैसे होगा, जब हम बच्चों को हेल्प करते हैं, उनको कडल करते हैं. सो आपको उनको कंफर्ट करना है. जैसे ही बच्चा रोता है, द मोमेंट यू बेबी स्टार्टेड क्राइंग, यू नीड टू रिस्पॉन्ड क्विकली. else in India it has been said very regularly that बच्चा रो रहा है तो उसको जल्दी मत लो, otherwise he or she may get spoiled. You are spoiling your baby. Let him cry for some time. But this is absolutely wrong. If your baby will have that confidence that if I start crying, my mother will take me and cuddle me, so he'll have that confidence and he'll have that assurance, right? So he will not panic and he will not be in so much of stress. So respond quickly and promptly to your baby's cry. Pick him up, cuddle him, and give him as much as skin to skin contact as possible. Okay, then carry your baby, talk with your baby. You can feed also while you are walking, because that is in rhythmic motion. Okay, when you are feeding and walking, that is in some emotion, your baby might feel quite okay with that. And then you can talk with 5S sound, that is shh, shh, shh. और यू कैन मेक सम वाइट नॉइज. वाइट नॉइज मतलब क्या होता है ना, जब बेबीज गुम में होते हैं, देर इज अ साउंड. So this sound is very familiar to them, and you can have this on with the fan or with dishwasher, or this is called as a white noise, which is very soothing for babies. And then you can hold also your baby like the tiger in the jungle hold, which is very comforting for colic babies. The hold is like this. You are supposed to take your baby like this. Okay, am I visible clearly? So put your baby on your tummy, on your forearm, and
Can you
the
lift it? Can you lift it up, doctor?
The
yes,
baby
is
has
it,
or the camera.
is it now?
Yeah, yeah. Your
Yes,
your
and
hand
just
is not visible.
okay,
Yeah,
like
yeah.
this.
Okay, okay,
And
okay.
just gently tap the back. This is very comforting to the baby. जब भी आप देख रहे हो कि बच्चा बहुत ज्यादा रो रहा है, आप उनको इस तरह होल्ड कर सकते हो. आपका बच्चा इमीडिएटली रोना बंद कर देगा एंड ही विल फील वेरी काम एंड सिक्योर, बिकॉज उसका टमी यहाँ प्रेस हो रहा है आपके आर्म से. एंड आप जैसे उसको बैक पे रब करते हो, बैक मसाज देते हो या पैट करते हो, तो ट्रैप्ड गैसेस रिलीज होने में भी मदद मिलती है. सो दिस इज अ वेरी गुड मेथड टू रिलैक्स टू अ कोलिक बेबी. ओके, एंड देन यू कैन सिंग टू योर बेबी. और आपको जब आप बेबी से बात कर रहे हो, तो यू कैन टॉक इन अ वेरी सूदिंग वॉइस इंस्टेड ऑफ लाइक वी शाउट. You should not shout. It should be a very lovable and very soft tone. Then swaddling, it also helps to calm the colic baby. Okay, and pat the back of your babies also. This is also some of the techniques which helps to calm the colic babies. Now the other reason for the to baby have colic is overstimulation. Overstimulation matlab, this, if there is excessive light, if there is excessive sound, okay, that also overstimulate the baby and the baby cries inconsolably for that also. If the babies are overtired also, तब भी वो बहुत ज्यादा रोते हैं, excessive crying होता है उनको. तो इसके लिए आप क्या कर सकते हो, you can reduce those stimulation. Just dim the light, close all the curtains, and the room should be completely noise free. And you can talk in a very soft tone and just swaddle your baby with very soft cotton fabric, and try to sleep him in such a room where there is no noise and no light. So this will reduce all the stimulation, and your baby might get very calm and just go to sleep. Now the other point is, try some for rhythmic motions. Rhythmic motions means you can just take your baby and bounce, and you can just sway side to side motion and up and down motion, but you are not supposed to shake your baby. You should never ever shake your baby, because this might cause blindness. Sometimes this might cause severe injury also. Okay, so shaking is not at all advisable. You should hold your baby, dance with your baby, bounce, you can sway. Okay, you can feed also while walking, but never ever you should shake your baby. Okay, and then there is a tummy massage. Tummy massage is, for tummy massage, what you should do is, my baby visible?
Yeah. Yes. Yes, doctor.
So what you can do for tummy massage, the massage, you should take some coconut oil and just just rub your hands so that your hands get little warm. Okay, and then with just gentle finger pressure around the navel in circular manner, you should do the massage. Okay, just 3 to 4 times clockwise and 3 to 4 times anti-clockwise. Then what you can do, massage with these three fingers under the ribs towards the pelvis area in the circular motion, from under the ribs towards the pelvic region. Then the other point is, you should hold the legs of your baby and try to push towards the stomach very gently till the point you get resistance. Just count one, two, three,
Can you
four.
show the baby a bit upwards, doctor? Yeah.
See, you should hold both the legs of your baby and then try to push the legs till the point you get resistance, and then count one, two, three, four, and then again back very gently. Just 3, 4 times like this. Okay. Then the next exercise is, just press the this feet portion. Okay, so these all points, pressing such points will help to release the gas of the intestine, which will calm the colic baby.
Can,
And the most important point to comfort the colic baby is double triple dose of tender loving care. The moment your baby will understand that I am being loved and I'm being taken care of, he'll calm down and he'll have a good time. And if the colic is due to GIT related issues, then the mother should look for certain points, like she should try to eliminate the cow milk or the cow milk products, if at all that is the reason for colic. So, one food item at a time she should eliminate and wait for 2 weeks to see a result. For example, it is peanut, for other food like peanuts, cabbage, onions. If these are the culprits for colic in babies, and if the babies are formula fed, the mother should check with the pediatrician, is there any other reason is there for colics, or she should change the formula, brand of the formula. And she can check for the bottle also. If the size of the nipple of the bottle is very big, then it will what it will do, lot of air will go inside while the baby is drinking from the bottle. So she can try for the anticolic bottles. उसमें क्या होता है ना, निप्पल साइज बहुत छोटा होता है, एंड जब बच्चा दूध पीता है तो एयर ज़्यादा नहीं जाती एंटीकोलिक्स बॉटल में. सेकेंडली, जब बॉटल फीड बेबीज में कोलिक्स आमतौर पर ज़्यादा देखा जाता है, बिकॉज बहुत सारा दूध एट अ टाइम बेबीज गल्प करते हैं. सो व्हाट यू कैन ट्राई फॉर सच बेबीज इज, यू कैन गो फॉर अ पेस फीडिंग. इफ योर बेबी इज लाइक दिस, ओके, सो यू शुड पुट द बॉटल डाउन फॉर सम टाइम. पूरा आपको वर्टिकल नहीं रखना है, मेक इट हॉरिजॉन्टल फॉर सम टाइम, allow your baby to gulp that milk, and then again like this. So this is called as a paced feeding. And try to feed your baby in upright position like this, not in the supine position. Okay, like this. So this will also eliminate the trapped gases. Okay, and lastly, if the mother is very stressed out, and I understand it is very disheartening to see our precious one crying so loudly. So अगर मदर बहुत ज़्यादा स्ट्रेस आउट है, तो आई थिंक शी शुड चेंज द पेस. इट मीन्स शी शुड अलाउ हर हस्बैंड or some family members or confident friends to take the role in the such situation, and she should go out and see what other members are doing. and she can relax a bit, because many times mothers are so tired and so overwhelmed by the situation that they feel I am whole solely responsible for everything, and the most important thing they do in such things are they gave up on breastfeeding and go for bottle feeding, which will again worsen the situation. And as ma'am had said, in such situation you can also go for a car ride, you can put the baby in stroller and go out and look for trees and something that pigeon, and then you can sing a song. Try as many things as possible, because we never know which will work for our baby. आज ये चीज काम की है, मे बी 2-3 दिन बाद you have to try another one. So there is not a one simple answer to handle a colic baby. You have to try everything and see which best suits for you.
Thank you, doctor. Thank you so much. I hope all the mothers took notes of what all you said, because every piece of information which you gave was so valuable. And many moms, I hope that everything is noted somewhere for the moms who are suffering here. Thank you, doctor.
I'd
And
like to
uh,
add just one or two things, as Dr. Rupal has very nicely explained everything that has to be done. One thing is, as she explained, that the chance of colic is more in bottle-fed babies. So pediatricians are actually heavily against bottle feeding. That if at all you need to give top feeding, the better method is to give it with a spoon or with a katori directly, because yes, aerophagia is more with bottle feeding. Plus, the baby will leave your breast earlier because of nipple confusion. So, breastfeeding is also prematurely. It ends up, you end up stopping breastfeeding prematurely because the baby starts preferring that easy way out. And there is a higher incidence of infections in bottle fed children. So, if formula fed, ideal way is no bottle. Okay, so in general, for a lot of reasons, and again, as she rightly said, that yeah, the incidence of colic is also more. So, I think if you give it spoon, then that also would be a benefit. And do not stop anything from your diet without the advice of a doctor, because only in case of cow milk protein allergy has it been proven that with research that something in the mother's diet is causing colic in the baby. So only if it's a diagnosed case by a doctor, again, because cow milk protein allergy is not as common as with influence, and with a lot of information out there, people sometimes randomly stop cow milk, but there is actually no real evidence of cow milk protein allergy. So again, do it in conjunction, take advice from your doctor, and don't stop anything on your own. That is what I would say.
thanks for joining us today. Let us have
I think the voice is
yeah, wait a second. Am I audible now, doctors?
Yes.
yeah now.
Thanks for joining us today. The tips you have provided us are extremely helpful, and I'm sure all mums and dads will find them useful too. With that, we come to the end of the session today. Thanks to our wonderful viewers who joined us today, and thank you, experts, for sharing us so many helpful pointers with us. And do keep following us on BabyChakra and stay tuned for more helpful parenting videos and tips.
Thank you so much.
Thank you.
Thank you.